Hello, my name is Chris and I hope to be your next RACGP President. As GPs, we've been through a lot in the past few years. We've had a decade of Medicare freeze, pharmacists being allowed to prescribe for urinary tract infections and dispense other medications even without a script as GPs sit with empty books. Nurse-run urgent care centres funded by state governments at far greater cost and expense with no evidence of benefit over the care of an excellent local GP. We've had billion-dollar pathology companies lobbying government to limit fairly negotiated rental agreements with general practices and succeeding. And we're the only health practitioners with enforced bulk billing. Even nurse practitioners are allowed to privately bill all telehealth. I think the RACGP should stop talking and start doing. Politicians do not listen to well thought out essays written by well-meaning GPs. They cherry pick parts of these essays, accept any measure that involves cost cutting or increased bureaucratic control, and ditch the rest. Politicians get photo opportunities while general practitioners and our patients suffer. This has to change. Big pathology and the pharmacists have shown us how effective advocacy is. We may not like all aspects of lobbying, but to not professionally lobby will continue to harm general practice, and this will harm our patients. The consequences of doing nothing are stark. We can't even fill our current training positions for the next generation of GPs. We need the best of the best doctors working in our profession. Care will become increasingly fragmented. As GPs lack funding to manage our day-to-day, pharmacists and nurses will continue to encroach on one side and subspecialists on the other. Our bread and butter, chronic disease management, will increasingly fall to these groups. This will increase taxpayer costs, increase patient costs, decrease access, as well as decrease the quality of care. We have to act now. Join with me and become a voice for positive change in the RACGP.